Welcome back to Healthy Living. So we talked in the first segment about Colorectal Cancer Awareness Month because at St. Tammany Health System, we like to talk about education, screening, and prevention. And that's what we do. So today, right now with me, I have Joy McWilliams. She is our Breast Imaging Supervisor at our Women's Pavilion. And thank you so much for joining us today, Joy.
No problem. Thanks for having me.
No problem at all. We're glad to have you. So we have something coming up. We want to talk about the Women's Pavilion.
Sure.
For sure.
Yes.
But before we talk about that, we want to talk about something that we have coming up in early March under our kind of United in Pink umbrella. Mm-hmm. It is a ladies' night out.
Correct.
And tell people the name of the ladies' night out.
Sure. So we are hosting a ladies' night out event at the Covington Beer Garden. It's going to be Friday, March 8th from 5 to 7. And this is just going to give women an opportunity to have their baseline first screening mammogram, or if they're just due for their mammogram on our Be Well bus.
Awesome. So we're calling it, I'm just going to hold up the flyer, but we'll get a better picture for you. It's called Baseline Bunnies.
Yes, that's our theme, is Baseline Bunnies, because, you know, so baseline is just a patient's first mammogram. So it's recommended for women age 40 to start having their mammogram. However, I know there's women out there who have never had a mammogram and they are over the age of 40. So we just want this event to just kind of encourage women to come out and just make their health a priority.
Yeah, and so when we talk about a baseline mammogram, you know, I have a young daughter. She's 20, and I'm starting to talk to her about her future health care and things that she'll need to do. But why is it so important to have that baseline? What's the importance of that?
Because that is the first initial imaging that you're going to have that the radiologists look at. So mammograms, you have them done yearly. So over the year, those radiologists are going to compare to all of your prior imaging. So if they see any little change in the breast tissue, it's early detection. You know, they can detect cancer or something that's abnormal early, which gives a patient more of a treatable prognosis.
Sure, their outcome is much better.
Yes, yes.
Or it can be a better outcome.
Correct.
Right?
Yes, ma'am.
So even if you have your baseline mammogram, say that I skipped 2 years. Is that a reason for me to say, well, I don't know if I should go back and get another mammogram?
Never. Yes. It is very important to just come and just have your mammogram done yearly, even if I know time slips away and people forget, and, lots of women, we're taking care of other people in our family, but again, we got to set back and just take care of ourselves.
Right,
Yes.
make your health a priority, really.
Yes.
Yeah. So.
And this event also gives women other opportunities for health educational and screenings. We're going to have carotid ultrasound screenings, musculoskeletal screenings, lung cancer education, and skin cancer screening and education with Dr. McDaniel.
So those are big ones because all of this, your breast health is extremely important, but so is your heart health and your skin health and your lung health. And we've learned just over the past couple of years that lung cancer in women is on the rise. It's rapidly catching up to the lung cancer rates in men. So this is something, while we're not going to be able to screen you necessarily at this event, you will get education and resources on how you can get those screenings. Correct. But when we talk about carotid artery screenings, for example, that is affecting your brain and your heart. I mean, your carotid artery, that's your pathway.
Yes, ma'am.
So those will be available there as well. And skin cancer screenings, that's very important. Last year at our Women's Health event in October, we had an early catch of melanoma at this screening event. So yeah, I talked to, it's a friend of mine, talked to her the other day, and she said, yeah, I was at the ladies' night out. And I said, well, I might as well have this looked at. It's been bugging me. Right. And I have an appointment in December with my no, she found the melanoma at our event.
That's awesome.
And it was caught early.
That's awesome.
And she was treated.
I think I'm going to be in line for that too. Take advantage of it.
We're going into spring and summer. It's a good time to kind of get everything checked out.
Absolutely.
So let's go back to the mammograms for just 1 second, because another thing we were kind of talking about is if you did just have your mammogram, say in October, you want to wait that full year, right?
Correct.
Why would you want to wait the full year?
It's just that's what's recommended by our radiologist. So it's, to make sure to have it done yearly, and just things can change within that year. If you have it too soon, it's
you might miss a change.
Correct.
Right.
Yes.
So when someone does, like if you do get your mammogram and something is discovered, you know, there's a lot of things it could be, right? It's not always the worst case scenario.
It's not the worst case scenario.
But what would my next step be? So I get my screening mammogram on the Be Well bus at the Baseline Bunnies event.
Correct.
And they call me and say, listen, we have a finding. What are they going to tell me to do next?
So one of our nurses will kind of coordinate the patient to make an appointment at the Women's Pavilion. They would have to get a provider's order for that diagnostic imaging. But when the patient comes, they will have a diagnostic mammogram and or ultrasound to take a closer look at that finding.
Okay.
After the imaging, the radiologists look at the images the day the patient's there. So, you know, the patient will get results that day. So the anxiety of waiting, you'll get the results that day. You know, hopefully in cases it could be just benign finding of cysts or lymph nodes or, you know, anything like that.
Sure.
But if it is something abnormal that the doctor wants to test, which would be a biopsy, again, that day we would have our nurse schedule the patient to have the biopsy.
Okay.
Now, you wouldn't have the biopsy that day, but our nurses are they're really good at educating our patients on what they are going to have done with the biopsy.
Yeah.
Yeah.
And we can handle the biopsy at the Women's Pavilion.
Correct. We do it through mammography or ultrasound and MRI.
Yeah. And we talked about this, I think, last time you were here.
Yes.
Joy joins us a lot, thank goodness, because she's a wealth of knowledge. But we talked about our stereotactic breast biopsy table, which is a newer model that we got.
Yes.
And it's increased the patient comfort, lessened patient anxiety, and sort of made the process much more efficient.
Correct. Yes.
So.
It just gives our radiologists a precise target to get to that lesion that they're trying to get at with our new table. It lessens the anxiety because the patient is lying down. You know, before we had a capability of a patient sitting up. You know, when you're sitting up, you can kind of see in your peripheral vision. So it does increase the anxiety to the patient. So lying down, they can't see anything, you know, so that does lessen the anxiety.
Yeah. And then couple that with, like you said, the caring and compassionate people that are working with you at the Women's Pavilion.
Yes.
So that's a really good combination.
Absolutely.
For a great outcome.
Absolutely.
So let's talk about if I go to my doctor, he tells me this. How do I say I want to come to the Women's Pavilion? Do I need a referral? Can I choose you? What's the process?
For just a screening mammogram, no. A patient does not need to have an order.
Okay.
They can call the Women's Pavilion, make that appointment, or if they have MyChart access, they can schedule the appointment as a self-referral on MyChart. You know, we are accepting or offering same-day appointments.
Oh, good.
We also offer screening mammogram appointments on Saturday mornings.
Oh, wow, that's convenient, especially if you're working.
Correct, and then that's what's important about these events too, is if a working mom or, you know, lady who just doesn't have the time, we have these after-hour events to have it done.
Sure. So where you're located, real quick?
We're located on Highway 190 in Covington. Address is 301 North Highway 190, Suite C2. Landmark, we're behind IHOP and Movie Tavern on 190. Yeah.
So what other services besides mammograms, biopsies, anything else that we didn't cover that is offered there?
Correct. So we offer screening and diagnostic mammography, breast ultrasound, the breast interventional procedures. We offer MRI, bone densities, and pelvic floor therapy.
Oh, wow. Okay, so you have a whole smattering of things offered for women, Women's Pavilion.
Correct.
Good.
Correct.
So is there anything else you want to add that we haven't covered about the Women's Pavilion, about people at the Women's Pavilion, about services, anything like that?
I would just love to let patients know the quality of care they're going to get at the Women's Pavilion from our staff members. They are just professional, caring, and compassionate to our patients and our radiologists. They are breast fellowship trained radiologists, so they are solely dedicated to breast imaging. You know, they don't perform procedures or practice medicine in any other field. So we just want patients to just feel that confidence and comfort knowing that they are getting the best quality of care in their breast health journey.
Great. Well, that is so good to know. And it gives me peace of mind because I have 2 daughters, right? And I am a woman. So it gives me peace of mind that we can get that right here on the North Shore.
Correct.
Yeah.
Yes.
So we just want to mention one more time. We're going to, again, show you a better picture of this. But this is our event that's coming up. It's coming up March 8th. It's a Friday night. Get your girlfriends. Come on out to the beer garden, the Covington Beer Garden. It's from 5 to 7 p.m. We have education, resources, screening opportunities for you. and we want to see you there. So please join us. Joy, thank you so much for coming on Healthy Living and talking to us about the Women's Pavilion and all things women's health. We appreciate it.
Thank you.
And thank you for watching Healthy Living. We'll see you next time.